Hi, this is Dr. Bhargava, and this short video is about PET-CT presentation state. How do you present your PET and CT images? Is there a right way to do it? Is there a way that you can convey the most information to your audience? This is my take on it. So start by showing the rotating image or the MIP image. So here we have two images from the same patient who was diagnosed with breast cancer. Take a look at the image on the left. It almost seems like they have bilateral metastatic breast cancer, but is that true? And after windowing it a little bit, here's the rotating image on the right. Now here the pathology is more clear that they have breast cancer in the left breast, they have extensive metastatic disease from that, and they're probably lactating, and there is increased uptake in the right breast tissue from stimulation. So showing the rotating image is very important. One, because there is physiologic distribution of the radiopharmaceutical scene, so the audience or the reader knows which radiopharmaceutical was used, looking at the distribution. Windowing it is important, because then you're not creating any lesions artifactually, and you're able to show relative glucose metabolism, as in this case, throughout the whole body. And that's important, because that's how a person who's looking at the images can look at that focus in the left breast and say, hey, there is focal hypermetabolism compared to the surrounding soft tissues. So always start by showing the rotating image or the MIP image. My next advice is to specify the radiopharmaceutical. So when you show the whole body rotating image, it is obvious that from the biodistribution, which radiopharmaceutical is used. So now, after a very long time of just doing only FDG PET studies, we are now doing PET-CT and PET-MR studies using other radiopharmaceuticals other than FDG. So let's start by quickly reviewing the biodistribution. Here is F18-FDG. Next is F18 sodium fluoride, followed by gallium-68 dotatate. You see that characteristic uptake in the pituitary. And then at the end, we have gallium-68 PSMA with characteristic uptake in the lacrimal glands. So start by showing the rotating image in the right intensity. And when you're talking about it, talk about or specify which radiopharmaceutical was used. Next, use the right window to highlight the PET findings. So here I'm showing at the level of the breast, the same patient with a CT image in the soft tissue window showing normal appearing right breast, a tumor in the left breast, which is in the subareolar region, and that tumor shows focal hypermetabolism, and the stimulated right breast from lactation shows some increased uptake, but not as high as the tumor in the left breast. My next advice is to use arrows to highlight your finding, and also to share correlative imaging findings. So here on the slide, we have a panel showing the whole body image, and I'm trying to show you with the help of arrows the focal hypermetabolism seen in a metastatic subcarinal lymph node on the CT image, on the PET image, and then also on the fused PET-CT image. My next advice is to show the CT finding in appropriate windows. So here I'm showing you focal hypermetabolism in a left upper lobe lung nodule, but the corresponding CT image is in a soft tissue window where the lung nodule is not seen. So in this situation, this is what is a better thing to do, to show the sub-centimeter lung nodule in the lung windows for the audience to appreciate that there is a nodule that takes up FDG and is likely metastatic. All right, and finally, do not use the word focal hypermetabolism for non-FDG PET-CT studies, because F18 sodium fluoride is taken up by chemical adsorption at the site of bone turnover. Gallium-68 dotatate and gallium or F18 labeled PSMA are taken up by receptor binding. So when you see focal uptake, call it focal uptake. Do not say hypermetabolism. Reserve that term only for FDG PET-CT studies. So in summary, start by showing the rotating image, specify the radiopharmaceutical, use the right window to highlight the PET image, point out the findings using arrows and share correlative imaging findings, show the CT finding in appropriate window, and do not use the word focal hypermetabolism for non-FDG studies. Thank you for watching.